Welcome to a presentation about kidney stones brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Kidney stones can be thought of like a traffic jam. The kidneys are like a highway, and the stones are like cars that have stopped in the middle of the road. The cars, stones, block the flow of traffic, urine, and cause a backup. This can cause pain and other symptoms as the body tries to push the stones out of the way. Symptoms of kidney stones can vary depending on the size and location of the stone. Common symptoms include pain in the side or lower back, pain that radiates to the lower abdomen and groin, nausea and vomiting, blood in the urine, cloudy or foul-smelling urine, and a frequent urge to urinate. In some cases, there may be no symptoms at all. If you experience any of these symptoms, it is important to seek medical attention right away. Kidney stones are a common condition that affects people of all ages, genders, and backgrounds. However, certain demographics are more likely to develop kidney stones than others. Men are more likely to develop kidney stones than women. In addition, people between the ages of 20 and 40 are more likely to develop kidney stones than those outside of this age range. People who live in hot climates or who have a family history of kidney stones are also at an increased risk for developing the condition. People who have certain medical conditions such as gout, urinary tract infections, or metabolic disorders may also be at an increased risk for developing kidney stones. Additionally, people who take certain medications such as diuretics or calcium-based antacids may be more likely to develop the condition. Finally, people who have a diet high in sodium or animal protein may be at an increased risk for developing kidney stones. Kidney stones are caused by a variety of factors. The most common cause is an imbalance in the levels of calcium, oxalate, and uric acid in the urine. This can be caused by dehydration, a diet high in animal proteins, or certain medications. Other causes include infection, kidney disease, and inherited metabolic disorders. In some cases, the cause of kidney stones is unknown. Treatment for kidney stones depends on the size and location of the stone, as well as the patient's overall health. Small stones may pass on their own, but larger stones may require medical intervention. If the stone is too large to pass on its own, your doctor may recommend a procedure called extracorporeal shock wave lithotripsy (ESL). This procedure uses sound waves to break up the stone into smaller pieces that can then be passed in the urine. In some cases, surgery may be necessary to remove a large stone. During this procedure, an incision is made in the back and a tube is inserted into the kidney to remove the stone. Your doctor may also recommend medications to help reduce pain and prevent infection. These medications can include antibiotics, pain relievers, and anti-inflammatory drugs. In addition to medical treatment, your doctor may recommend lifestyle changes, such as drinking plenty of fluids and avoiding certain foods that can increase your risk of developing kidney stones. The prognosis for kidney stones is generally good. Most stones will pass on their own within a few days to a few weeks with the help of increased fluid intake and pain medications. In some cases, medical procedures may be necessary to remove larger stones or those that are causing complications. If the stone is causing an infection, antibiotics may be prescribed. In rare cases, surgery may be needed to remove the stone or repair any damage it has caused. Overall, most people who have kidney stones will make a full recovery with no long-term effects. However, it is important to follow your doctor's instructions and take any medications as prescribed in order to ensure a successful outcome. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinali.com/info. Be safe. Love you.